Hello, everyone, and welcome to the Wealth of Health podcast news segment, where we kind of discuss the latest topics and latest articles that we scanned over from a number of newspapers, and then we put our comments on it, and we either agree or disagree. On today's episode, from the Mail Online, half of British adults should be able to get their hands on fat jabs through the post, says Tony Blair. And also from the Mail Online, bodybuilders face high risk of sudden cardiac death, especially those who compete professionally, study finds. This is coming up on the Wealth of Health. Hello, everyone, and welcome to the Wealth of Health podcast. My name is Ahmed. I'm the Chief Exec of Echelon Health, and with me, as always, is Dr. Paul Jenkins, endocrinologist, consultant physician, and medical director.
Welcome, everybody.
Paul, I guess we're doing things a bit differently today. And if people like this series, I think we will continue with it alongside our main health topics that we discuss in the studio. But on these, we really want to just touch base very quickly and comment on some of the articles that we read in the newspaper about health specifically. I think it can be very confusing sometimes. There can be some contradicting views. One newspaper will publish something and another will publish the complete opposite. So how would people find out which one is correct or what's scientifically based and what's not? That's what we're trying to do on this segment.
Yeah, I think also, everybody has different views, don't they? So the papers will take always one slant that they've perhaps already decided and write the article accordingly. And there's often, we all know there's not a true right or wrong in it. There's different perspectives, but I'd like to think we can perhaps put some medical facts behind it for people to make their own mind up or
yes,
put a different perspective on.
Absolutely, and this is where your point of view comes in. I normally bring the cynical point of view on things. So with that, let's start with the first article. Mail Online, half of British adults should be able to get their hands on fat jabs through the post, says Tony Blair. I love the fact that they call it fat jabs. So what is your take on that? The article proposes that this is something that the NHS should make available. It should make available over the counter. The threshold, the obesity threshold, should be lowered to allow more people to get their hands on this jab. And the idea is that potentially in the future, by 2035, this would have a huge benefit because less people will be chronically ill, and so the strain on the NHS would be reduced. But what is your take on that?
Well, Ahmed, we have had previously discussed, about the fat jabs in general and the pros and cons of them, the so-called fat jabs, the GLP-1 agonists. Look, firstly, they can be effective in helping individuals to lose weight. But it's, to my mind, and I do prescribe them quite commonly, it's part of an overall strategy of educating people more about the weight, the causes of weight gain, how they can reduce weight. And ultimately, it may not be, popular or, everybody wants an easy fix, I guess. But the reality of losing weight is you've got to put less calories in than you burn out. That's that's the basic first law of thermodynamics. So you've got to consume less calories and of the right foods. The so-called fat jabs can increase the feeling of satiety, so you feel full easier. You don't want foods. But should the NHS fund them? Well, look, I think the reality is that the NHS, everyone thinks the NHS is sort of Father Christmas. It just keeps on giving. Yeah, but it's not. Someone has to pay for it. Yes, and that's what we need to perhaps have we can open this up to a bigger debate, but it can't fund everything. Yes, the current NHS budget is close to £200 billion. Yeah, it goes up. 10 years ago, it was around 130 billion. Yes, it goes up and up and up. But the fact of it is that we'd all accept the NHS is probably on its knees. every day we're hearing stories about it, and everybody, pressure group, everybody says, "Oh, put it on the NHS. The NHS should be providing this, should be doing this or that," but it just can't do everything. Yes,
Yeah.
and I used to be in the NHS for 20 plus years, and I know, and my father was a doctor, physician in the NHS, and he was always saying, "Oh, it's broke, it's struggling." Yes, so I have been hearing this for 50, 55 years plus.
And
So,
yet it's still standing.
well, yeah, but I have to say it is, it's really on its knees now. Yes, and my wife is an NHS radiologist, and the stories I hear, currently every meeting they have is not about improvement; it's about how to cut costs. Yes,
Right.
it's just saving, and every year it's about saving. And I've got, a lot of colleagues still in NHS endocrinology, and it's pretty brutal out there. So it's a fantastic institution. It is one we should be rightly very, very proud of. And when the proverbial hits the fan, the NHS is what you want. It is
Yes.
unbeatable in
100%.
that, in my opinion, and we can still do truly, truly world-leading medicine, and for the major factors. But should it fund everything like this? When the reality is for obesity is, and it's not glib to say, it's to eat less, and we need to start at sort of a nursery school level.
Mm.
Yes, and at infants, junior school, is educating children about food, yes, about nutrition, and about cooking healthy meals and avoiding the ultra processed foods, avoiding the high sugar foods. I think yes, we should have a sugar tax because the biggest cause of obesity is highly refined sugars, or excuse me, foods which are high in refined sugars. So if we reduce that and we educate people about the need for a healthier lifestyle, which is to eat better, less refined foods, less saturated fats, and the importance of exercise, that's the way to treat the obesity. Yes.
Yeah.
I mean, I think so. That's one aspect of it. The second aspect of it is we don't know the safety of these so-called fat jabs yet.
And that's what I wanted to touch on. I mean, I have to say the article doesn't clearly state that the NHS should fund this, but it does say that they're suggesting lowering the criteria that allows people to get those jabs and to get them over the counter and make them available. But I don't know, and make them available without having to see a GP first. So I don't know if that kind of subliminally includes the fact that the NHS funds it or make it available at a lower price. But they're basically suggesting, the article, the Tony Blair Institute is suggesting that the threshold is lowered so that people don't have to see a GP, they can easily get it, whether it's funded by the NHS or not. I think the challenge with something like this is that we still don't know the long-term effect on a population-wide availability of a drug like that. And you're right, we discussed this before. We just do not know. And there is an angle, of course, in the article suggesting that different economic levels or people in needy in areas of need, economic need in the country, these are the people who suffer most out of obesity. So it should be available a lot more to them.
Yes.
But then you have the chicken and egg. As always, it is the people who can't afford it, it is the people who are poor, is where we kind of suggest that we do these things, but we do not have a definitive study of the long-term impact. So again, you're suggesting helping because obesity is a lot more prevalent in lower economic areas, but then you could also be harming them long-term because we
Yes.
still do not know. So what is your take on the whole thing that obesity is more prevalent in lower socioeconomic places, areas, or deprived areas, as they call them? Is the solution that we just make the fat jab available to them and make life a lot easier? And first of all, if this is true, and I haven't done my research as usual, why is places with lower socioeconomic level suffer a lot more from obesity?
And I think that is because the ultra processed foods are more widely available and can be produced cheaper. Yeah, but
Right.
that's not necessarily then that's not healthy for you. Yes, and we in terms of making them more widely available, you absolutely should not be making medicines like these, which are quite complex drugs with unknown long-term effects, available without a medical prescription. I think that would be completely irresponsible. And yes, as with all medicines, you've got to weigh up the good and the bad. And every medicine has side effects or potential side effects. And patients should, and it's just common sense, but certainly good medical practice, that patients make an informed choice as to whether they want them. And I prescribe, the so-called fat jabs quite widely for my patients with weight issues, if that's what they want. Yes. So, per se, I don't have it, but that's in the independent sector. If patients choose that this is how they want to, spend their income. But having said that, around 50% of patients, when I go through it with them and explain that this is a relatively new drug, we don't know all of the side effects, there are some potential significant side effects, then say no. Oh, no, I don't want that. No,
Wow. Up
I
to
wasn't aware of that.
50%.
Absolutely, I wasn't aware of that. Well, I'll just push on, and I'm going to push harder. Yeah? We all want a quick fix.
Mm.
That's human nature. Yeah. So give me the jab. I can carry on with my lifestyle. I'll lose weight. Yes. But to be honest, life's not like that. The reality, quick fixes don't really occur. And you get an out for free. Yeah. And there's a potential price to be paid, let alone the big issue. The other big question is, well, how long do you stay on them for? And how long should the
Right.
NHS fund this? Because yes, the manufacturers initially said 2 years. Yeah, and that's what the sort of the study showed.
Yes.
Yeah, but those 2 years are now expiring. Yeah, and there hasn't, they're not saying, oh, you must stop it now. Clearly, it's in their best interest, and we've discussed before just how expensive these are. And Novo Nordisk now has what's their income is greater than the GDP of most countries. It
That's the
is
country where they're based at.
astronomical amount.
Mhm.
It's billions of pounds a month they're making. Yeah. So, firstly, should that be put on the NHS? I would say no. But secondly, when you coming back to the point I was making, when you stop them, the studies show that people within a year regain all of the weight that they
Oh,
had
wow.
before. And in some cases, and this is even more of a concern, is that there's rebound above that. They're getting even more overweight than they were before they started it.
And as usual, if you make something available for everyone over the counter, no GP, no follow up, you have no way of tracking the use of it or the consistent use of it, uh,
Yeah,
or
yeah.
progress, or a lot of side effects will be missed because a GP did not prescribe it.
Yeah, and potentially fatal side effects. Yeah,
Uh,
and also some. I mean, it's all very well when everything goes well. People say, "Oh, that's fine, fine. Come on, don't be a misery guts. Just let me have this. It's my right. I should have it. NHS should fund it." Well, not when it goes wrong. Yeah, then people start pointing the blame and said, "Well, who gave this to me without proper informed consent?" And the Daily Mail will be squawking like hell when that happens. Oh, inappropriate, availability of the fat jabs caused me to, cause my daughter to die. Yeah,
yeah,
those are that will happen because that's a reality. If you make a drug so widely available, you will have the occasional, very, very adverse effect.
agreed. And I love this piece of the part of the article. Um, this is economic modeling by the Institute shows reducing the qualifying BMI is expected to deliver cost benefits net neutrality by 2035 and net gains year on year afterwards, which cumulatively it offers a fiscal benefit estimated by 52 billion. Now, it's a it's a hell
That's
of
up.
a analysis to make, but also the article suggests that people with a higher BMI more than likely have more sick days off work.
Yeah.
And if you make it widely available, this will boost production in the workplace.
But it's a sticking plaster over, it's addressing the symptom, not the cause. If it's going to save 52 billion, I'd rather spend a tiny proportion of that on better education, yes, making, giving children and school children healthy meals, spending just a little bit more. I mean, the amount that's spent on the school meals is tiny, and they just can't produce good, healthy food for that. So put that into educating children, because everything starts from children. Yes. And within, we have a generation of overweight children. And we've got to, we should be addressing that through the lifestyle, the fundamental education, and putting the tax on the high fat, high sugar, easily available foods.
I mean, I'm always amazed that, I mean, I meet a lot of people who will tell me, oh, no, my daughter doesn't eat anything except potatoes.
Yeah.
Or, oh, they will only eat McDonald's fries. I cannot get them to eat anything else. I mean, no judgment here, but if you allow your child to eat whatever they want at any time they want, and all they want to eat is sugar and starch, then this is the problem. I saw a documentary the other day about what they do in Japan, where they get the students to actually prepare the food
Correct.
themselves, and they have their own designated kitchens, and they teach them how to put healthy ingredients together and how to cook healthy food. And so it becomes ingrained and it becomes a lifestyle.
That's exactly what we should be doing. We used to do it when I grew up. It's, rather untrended. It's called home economics. Yeah,
Yes.
you've given lessons in this, and that's, I would say, part of the education. And in many other cultures, that's part of it. Yes. So, we've just completely sort of stopped that. Was, yeah, it's just gone from the sort of curriculum. But that's, to my mind, a fundamental part of education.
I agree. I want to read another part of the article that says the government, this is from the Dr. Charlotte Refson, the Director of Health Policy at TBI, which is the Tony Blair Institute. She says if the government is looking to improve health and drive economic growth, tackling obesity as part of a wider prevention agenda must be a key priority, which I agree with
Completely agree with
100%.
that. Yeah.
Anti-obesity medication are effective, well tolerated by those taking them, and highly scalable. Okay. The government must follow its instinct and be bolder. Anyone who suggests the government should be bolder just scares the life out of me. Providing faster, broader access in a more convenient way that meets them wherever they are, online, at home, and on the high street. The cost of treating obesity may be high, but the cost of not treating it is higher. When you say the word obesity and treatment, that suggests to me that obesity is a disease.
Well, there are undoubtedly, and look, I see an awful lot of patients with weight issues because, they're often hormonally related. Yeah. So I come across this very, very commonly. It's probably one of the most common things patients see me for. Yeah. There are genetic factors which increase the susceptibility to putting on weight.
Right.
Yep. The most common of that is something called insulin resistance,
Mhm.
where your body makes too much insulin in response to when you have any carbohydrates. And the two types of carbohydrates, simplistically, there's the refined sugars. So that's anything that tastes sweet. So that's the cakes, the biscuits, the sugars, the chocolates, the fruit, which is high in natural sugar. And then there's the complex carbs, the fillers, the rice, pasta, bread, potatoes, sweet potatoes, chips, pizza. Yes, and it doesn't matter, to be honest, whether it's pink, brown, blue, or white. It's all got carbs in it.
Yes.
Gluten-free, still got carbs. Yes,
So
but
all of,
that
Mhm. Please.
no, well, that then, when you have that in, your body senses it and it produces insulin to stop your blood sugar going too high to try and control the sugar. Some patients, and a high proportion of people, sort of genetically tend to make too much insulin. Yep. And so, in response, having carbs, their body's making a lot of insulin, but insulin actually makes you put on weight. So,
Yes.
you're then got this stimulus to be putting on weight. You then get into a bit of a vicious circle because when insulin puts on weight, fat tissue acts like a sponge to insulin. So it soaks up the insulin. So sort of next time you have any carbs, your body has to make even more insulin. to control the blood sugar. Yes, and then you put on even more weight, and so you get this vicious negative circle. Yeah,
Right.
and
So,
that's why people are putting on weight often, and that's why the very common complaint is, well, look, I'm having a healthy diet, I'm restricting my calories, yes, I'm going to the gym every day, but I'm pounding away in the treadmill, I'm not losing anything. The person next to me is fading away, losing weight by the minute. So, that's a common cause. Part of that, and the treatment of that is the education. Yes, you have genetic insulin resistance. The key for you is to really be ultra strict on the carbs. Yes. Yes, it's tough. And I don't doubt it takes a lot of willpower, a lot of discipline. But if you understand the causes for why A, you're putting on weight, and B, why you are finding it more difficult to lose weight, then you make that informed decision and you start cutting out the carbs. And
right.
slowly you do. Sugar is slightly addictive. Those big sugar spikes and downs, that's why people keep eating. But if you fundamentally change the diet to reduce the carbs and you get used to lean meat and fish and low carbs and vegetables, low carbs, then you start to lose the weight. And
Yes.
then you start changing the negative circle into a positive one. Now, with that in mind, there are some much more widely available, cheaper, and effective medications that can help that. And I use them very commonly, a drug called metformin, which has been used for 50 years plus for the treatment of diabetes.
Hmm.
And I tell patients as often, I don't know if I've said to you before, it's like my wife describes me: cheap, old fashioned, safe, and effective. It's, it's, it works.
Brilliant.
We know it's safe, and you can use that. And it has, in patients who are also making the dietary measures, can help them, makes them more sensitive to insulin, lowers the level, and it helps them to lose weight.
Yes.
That drug can be much more widely available because it's been used for 50 years. We know it. And except in patients, the only contraindications, patients with severe or significant renal or kidney impairment.
Hmm.
Other than that, it's safe. And indeed, in some studies, animal studies, it promotes longevity. So a
Wow.
lot of people in the longevity world take metformin.
But I just don't want to. I don't like there to be a confusion about, and I agree with you, there is certainly a section of society who are struggling with weight because of clinical reasons or because of genetics or because of hereditary reasons. But something in me is just not happy with labeling obesity in general as a disease. It can cause disease, but it is not a disease in itself. For some people, it is. For a portion of society, it is. But not everyone who's overweight has a disease, because that then, for me, takes the responsibility and the accountability from the person. It puts the onus on pharmaceuticals, because if it's a disease, it needs a drug to be treated.
Correct.
And then you get into a whole different vicious circle of everyone above a certain BMI saying, I want these drugs.
I agree. I agree.
So,
I mean, yeah, be careful, but people often like to collect, um, sometimes like to get labeled with a diagnosis. It takes away the personal responsibility. And that's can be quite a strong view, but the tendency, and the UK seems to be heading this way more and more, is to take away your responsibility for yourself, for everything, make it somebody else's fault, and therefore they need to give me a treatment. And
yes,
I deserve that treatment. I'm entitled to that treatment, rather than looking at the root causes of many things in our lives and saying, no, the state shouldn't be responsible for everything. I've got to take personal responsibility. It's up to me. And yes, it's tough, but I've got to make those personal choices and sort of sacrifices in all sorts of ways myself.
agreed.
That's a personal view, but it's, we're going slightly off subject, but the NHS is a wide-ranging provider, but it should not provide everything and take away, your individual responsibility.
Yeah, and I honestly, I mean, that's a very good note to kind of end the discussion on this article. But I don't think we went off topic, because even though in its on the surface, the article looks like, oh, we've done a research and we're suggesting roll this out to wider people. But it has so much more impact on society, on the way people think. Like there's so much depth and other dimensions to this article than the face value of it. And one of them is exactly that, is exactly, removing accountability from people and just, again, find me a solution, government,
Yes.
which leaves you with fewer and fewer of your own choices as the years go by. Okay, I think we've covered that article. We can move on to the next one about bodybuilders and sudden death. I know, I love
a
those.
different topic. Yeah.
Yes, but I love those, the Daily Mail titles are just so shocking and strong. Bodybuilders face high risk of sudden cardiac death, especially those who compete professionally, study finds. And then the article goes to talk about, pumping iron could have you at a greater risk, suddenly falling to your death. A major study of 20,000 bodybuilders has revealed. Researchers found those who had built extreme levels of muscle over their lifetime were twice as likely to die from sudden cardiac death compared to the general population. So that's a good starting point. Again, to me, it's a little bit strange because it's pumping iron can leave you at a greater risk of suddenly falling to your death. Well, no. Pumping iron on its own does not make you of greater risk. So this sentence is quite strange. And then a major study of 20,000 bodybuilders. And a lot of people will look at this and read the word bodybuilders and say, oh, that's not me. I don't have to worry about that. But bodybuilders, that term has changed drastically over the last 10 years.
Yes.
I mean, in a way, it's good because everyone at the gym, men and women from much younger age, are hitting the gym hard. They're lifting weights, they're lifting heavy weight. It becomes a very strict part of their lifestyle, which is fantastic to see, especially in light of the other article we were just talking about. But is it really just bodybuilding and lifting heavy weights that makes you more vulnerable or more at high risk? Or
it's a wonderfully, again, sensationalist headline, which of course the papers have to put in there to make us read or buy them and read the adverts. Yeah. Look, I mean, bodybuilding, as you say, encompasses a very wide range of people and degrees of activity. Yeah. Competitive bodybuilding nowadays, most of them can be so-called, inverted commas, dirty, close inverted commas. So they are, people competing them are utilizing illicit substances to help them gain the muscle mass and to achieve the ripped look and the loss of fat mass. Yeah, that's how they win. Yep. And the most common substance used for that is anabolic. We call them anabolic androgenic steroids.
yes,
We've discussed before, but testosterone-like substances and substances which are even more potent in their testosterone and the male muscle-building effects. So there's a massive difference here, and maybe this is what the article is sort of alluding to without saying it, between men and women who are hormonally deficient or who have low levels of, and I see a lot of men with low levels of testosterone, who are taking testosterone supplementation to get their levels into the upper normal range. And in medicine, we call it physiological range, so the same amounts as your body used to make. So a form of hormone replacement, to the bodybuilders who can take astronomical and pharmacological doses. Yeah.
right.
And to put it into comparison, of testosterone equivalent, for men, they take something like 250 milligram every 2 to 4 weeks. Yes, bodybuilders would be taking up to a gram a day. It's astronomical amounts. So, and when we are young, we all perceive ourselves to be immortal. So your risk benefit criteria are very much skewed towards the benefit and not the risk. Yeah.
Yes.
And for the chance of them to win competitions, to compete, to achieve they have what we call a bit of body dysmorphia. So they're not really looking at their bodies with a objective look to achieve the perceived shape, build that they want, they're prepared to take more and more steroids.
Yes,
Yeah. And
100%.
we've discussed, but the culture in the gym culture, there's an awful lot of dodgy pseudoscience.
Yeah.
The personal trainers say this is the regime you need, the so-called the stacking, more and more different steroids, the cycling, we put the dose up for a few weeks, then down again. This is the cycle you need. Now you need to add in the diuretic, which is the water losing
Yes.
medicine to help you, achieve that ripped look. But that runs the risk that you become dehydrated, you get imbalance in your salts in your body, your sodium and your potassium. That significantly can increase your risk of cardiac, irregular heart rhythms and sudden death when you're taking to extreme. They're taking the growth hormone to excess for the ripped look, which helps you lose some sort of fat tissue,
Hmm.
and all sorts of other substances. So you've got a complete cocktail of very high doses of unknown actions in excess in young people who are then pushing themselves already very, very hard. And in the heart, with exercise to a very high level, you're already making your heart muscle bigger and thicker
Mm.
because that's how it pumps more blood. It's like any muscle with training, you get it. The bodybuilders want the biceps, he says, showing his little puny ones, but
Yes.
big biceps by training hard. Yeah, the heart will be trained hard, but these doses of the anabolic steroids in very, very high dose also further significantly increase the size of the heart vessels. So you get what we call a cardiomyopathy, a big, strong but slightly weaker heart, which is out of sync, and that's
Right.
often the significant cause of the sudden death.
I mean, the article does allude to that in a number of ways. Bodybuilding involves several practices that could have an impact on health, such as, exactly as you said, extreme strength training, rapid weight loss strategies, including severe dietary restrictions and dehydration. So
Yes.
the article does talk about this, but I mean, Arnold seems to be doing very well, doesn't he?
Well, Arnold, yes.
I know, my
But
special genetics, I guess.
yes.
Um,
But I mean, when I grew up, I don't know if you know, Florence Johnson was
yes,
the American sprinter Flojo,
yes.
died of sudden death. Yeah, a few years later, highly related to, thought to be related to, abuse. Yes, we do hear it. We've been known about it for decades. I'm afraid this is not new
No,
news.
exactly, exactly. I mean,
So,
and still in these days there are so many influencers who are bodybuilders slash influencers. I don't know, um, who do suffer sudden cardiac arrest, and there are, and then the videos go up on YouTube about these people and social media saying that is so strange. But I'm like, no, it's not. If
yeah,
you take 1 second to look at this person, it's very obvious that he's on lots and lots of gear, as they call it, that he's gone through extreme levels that maybe if he was in mid 30s or late 30s, you're like, okay, he's been doing this for a year. But these people are in their 20s. I'm
yeah,
like, how can you achieve that rapid muscle and mass gain in such a period of time unless you are going to extreme measures? So you're right. It's not a surprise, and actually, it goes also to wrestling. There was a Netflix documentary about that. How a lot of the WWE wrestling, American wrestling style, um, I don't know, wrestlers, not actors, they also had exactly the same. They suffered sudden death, a
yeah.
large number of them. And the fact is, as you said, is the combination of steroids, anabolic steroids, growth hormones, and the muscle mass and bulking and cutting, and it's just,
I agree.
I guess the heart cannot sustain that for a very long time.
Yeah, and I think the other significant factor we haven't alluded to is that the type of personality who would undertake this is also other risk taking, and a high proportion of sudden deaths is due to other drug abuse, recreational drug abuse, and cocaine use.
Yes, yes, there is a
And
culture of
as a
cocaine as well.
medic, if you the first cause of somebody young person having sudden cardiac death, top of your list is cocaine, opiate abuse. recreational abuse.
Wow.
And so, a lot of people, if of this mindset, if they're then taking heavy cocaine use, that's going to be the likely cause.
Okay. So would you say that then going to the gym, lifting as heavy as you can, getting your protein shakes in place and eating healthy and all of that lovely stuff, if you want to look after your body, even though you're not going to be the size of Arnold or whoever else is out there, this is not harmful for your heart.
Correct. Yeah.
Okay.
I mean, it's
So
just part of as always, limited life. Moderation is good. Yeah.
yes.
Regular exercise, and that should compose, especially as you get older, strength, weight training, exercise is fantastic. It's good. Our muscles do get weaker, reduced in size as we get older.
Mm.
It's called sarcopenia, and that's an increasing cause of frailty. So the more you can prevent as you get older, so the more you can prevent that by weight training exercise when you're younger and middle-aged, and indeed as you get older, but to a lesser extent, then that's a good thing. Yeah.
Okay. So I mean, I think on that note, that kind of concludes the discussion around this article. Going to the gym is not bad for you. Lifting heavy is
Correct.
not bad for you. Stay off the gear. You'll be fine.
Yes. Yeah. And
And
the cocaine afterwards.
and
Yeah.
I think this is probably the best point to end this episode on. We're trying new and different things in the show. If you do like this segment where we discuss bits and pieces about the news and articles that we read during the week, just let us know in the comments. If you have a specific article that you'd like us to comment on as well, please send us a link and we will put it up and comment on it, and it will go into the rotation. Thank you very much, everyone. As always, from me, Ahmed.
Thank you very much, and see you on the next episode.
See you on the next episode.